constantly asks you stuff. So it just said, do you want to continue with the meeting? It's being recorded. So I can see everybody. I like just do gallery view so I can see everybody who's in it. And I can get out of the gallery view. Yeah, you should have been here and I'll show you how you log in. And this is on UI.
And there's Pat. Hi, Pat. Haven't seen you for a while. Glad to have you join us today. And Deb, too. Do we want everybody to put their video on?
Yes, everybody is more than welcome to put their video on while they're participating today.
I just want to see their faces.
I know.
Somebody's the top of their head. Okay.
And there's Karen. Hi, Karen.
Theresa Brennan.
All right, so when we get started, I will put everybody on mute. Just an FYI, if something comes up, feel free to send me a message via the chat.
So they can mute everybody, or I can mute myself. Okay. It's better if she does.
Okay, so hello to our volunteers. We're glad that you're able to join us for our Lunch and Learn event today. Our guest is UI Healthcare Chief Medical Officer, Dr. Theresa Brennan. Not only is Dr. Brennan our CMO, she is also the senior leader for volunteer services. In the next half an hour, we'll hear from Dr. Brennan, her experiences, and at the end, she'll answer some questions that our volunteers have submitted ahead of time last week. So Dr. Brennan, thank you for joining us, and we're excited to hear what you have to say.
Well, thanks for having me. And thank you all for joining us today. I know it's an hour out of your life, and I hope that I can say some things that will be helpful. So Jean and Jilna asked me to just kind of give you an overview of who I am and what I do and how I got here. I will say I grew up in a small town in Wisconsin. I'm the youngest of 8 children. So that's an important piece of information and who I am and why I'm who I am. I went to University of Iowa for undergrad and then went to Northwestern for medical school. And during medical school, I met my soon-to-be husband and came back here and did all of my training here in Iowa City. Greg is a native of Iowa City. We have 2 kids, both are grown, and one out of grad school and one is going to graduate in just a few weeks. So I'm excited to potentially get them off the payroll. I trained as a medicine doc and as a cardiologist and then as an interventional cardiologist and practiced for a number of years during that time here. So I did all my training here at Iowa and began my practice here and have been here ever since. So I came here in 1992 and I tell people that I know where all the closets are and I know what's stuffed in most of them because I've been here so long. Throughout my course as a physician, I've held a few administrative roles and in 2011 was asked to consider being the chief medical officer of the hospital. At that point in time, most academic centers in 2011 had chief medical officers. We had never had one. Now it's pretty commonplace that even mid-sized and smaller community hospitals will have a chief medical officer to help just with issues that come up with faculty and physician staff. So it was a pretty new experience for me. And the role was brand new. So it evolved. Right now I oversee the quality office, our Office of the Patient Experience. I oversee our documentation improvement team, oversee a couple of clinical teams, the bioethics team, as well as our adult hospitalist program and our adult palliative care program. I also oversee privileging and credentialing of all of our physicians, our advanced practice professionals, ARNPs, PAs, to make sure that we're evaluating the people coming in so that they're of high quality that we would expect, and we are continuing to evaluate them over time as we're required by the Joint Commission. A few years ago, the volunteer program was placed under my supervision. So I'm pleased to be able to work with Jean. And I will say that that's been one of the really highlights of my career. I have often said that you are the happiest people on earth. And I really, really enjoy getting together with all of you at the events, the milestone events and the yearly events, and just hearing all the great things that you do. And we miss you. We miss you very much. I heard Mary say something about volunteering remotely. You just can't do that, right? And I appreciate y'all sticking with us. We will bring you back sometime, just not sure when that is. I can tell you there's been lots and lots of discussions about this. And those discussions really have focused on everybody wants you back. We get requests on a very regular basis. And I can tell you bringing the volunteers back has been a discussion at our operations group at least 10 times. And we really focus on when it's safe to bring you back. So we want you back, we need you back, and be assured that we will bring you back as soon as we feel like it's safe for you to come back. We feel like we have done a ton during this pandemic to make sure that we keep our faculty and staff and everyone who comes to UI Healthcare safe. You're in a different position because you don't have to come. We just want you to come. And so that risk tolerance, I think, is a little bit different when we think about our volunteers. So hopefully we'll see you soon. But I just want to say that, again, that we miss you and hope that you are doing well, and that you hang with us. And when the time comes, you'll be waiting to come back and do all the important things that you've done in the past. I don't know if I have much more to say about me. This is not a very comfortable position for me to be in, telling you about myself. My mom used to do that for me. So it's not my usual to be talking about myself. I don't know, Jilna, is there anything else that you wanted me to talk about, or do you want to get into the questions?
I think we can go straight into the questions. So we had some great questions submitted. And so I would like to start with what has been the most impactful moment of your medical career, whether that's pre-COVID or during COVID?
Yeah, I knew I wanted to be a physician when I was in 5th grade. And so I really set my whole life to be a doc. It's a great career, and I'm really glad that I did. I will say that when I was 17, my father had a stroke and ultimately passed away. And the experience that my family and I had with the physician who took care of him, the compassion and empathy that he showed, particularly my mom, but also, his straightforwardness and transparency about what was really going on with my dad, really had a significant impact. And so, I can look at a lot of things in my medical career pre-COVID, but I think that I would say that was probably the thing that had the most impact on me, because I knew that I wanted to be a doc like him. I wanted to be able to be honest and truthful and tell patients and families what I knew, but also to be able to do it in a compassionate and empathetic way, so that sometimes those words are harsh and hard to hear for families, and to be able to care for the patient and family's soul or their person as much as we are their body, I think is so important.
Absolutely.
Post-COVID, I think I would say that, what was most impactful to me in the COVID era was the night we got our first patient admitted. So I was actually at home and got a call from our emergency room saying that the patient who had been diagnosed somewhere else was coming and was pretty sick and would likely need to be hospitalized. And so that was the moment when all the work that had happened prior to that had to, really be put in place. It was the moment when the rubber hit the road, right? And I thought, should I come into the hospital or, the team's got it, right? And I couldn't help myself. I came in and I went to the emergency room, and I ultimately went up to the unit that took that first patient. And I think what impacted me most was just our people, and how in a moment when there was so much uncertainty, not only about the patient himself, but also about themselves. And, back then, we've learned a ton about COVID-19 since then. But back then, we had expert opinions, and we were really hopeful that all of the safety things we put into place were going to work, that, we knew as much as we could know, and that the things that we had put into place would really be effective to keep our people safe. But we weren't sure, right? We had to really live it out to know that those, where we started was really a great place to start. But what I saw that night was just how people just do their job, and they do their job so well. And, I watched them put their PPE on, and, they were meticulous and did it well. But then when they went in the room, they just did their job like they normally did. And that was really impactful to me to see how we have great people who work for us and with us every day. And that, even an obstacle, back then we thought it would be a short-term obstacle, or we'd have this fixed soon. That an obstacle like that didn't deter people. They just kept doing their job, and they took great care of that patient. And I'm pleased to say that that patient was extraordinarily sick when he arrived, and has subsequently been discharged. And, so really makes me appreciate the people that come to work here every day, and the work that they do every day. And I think about that moment a lot when we've tried to do all sorts of things with what we do for COVID-19.
Absolutely. So how have your previous professional and personal life experiences help you prepare and lead during this pandemic?
Yeah, this has been an interesting 8 months. I can't even count anymore. I enjoy leadership. I enjoy being a part of a solution, but this has really taken us all to a different level, and we've had to use a lot of skills and characteristics that maybe we don't usually use on a regular basis. But I would come back to a few things that are pretty constant in what we do in healthcare, in leadership, in a business anywhere, and that's that it's all about the team. So the team is so very important. And as someone who has the potential to lead that team and make decisions that have great impact on that team, I think what I've brought to COVID is, I love being a part of a team. I was part of a team growing up, in sports and things, and I really love the people interaction. But this really relies on the team. Everyone on the team has to be a part of the solution. And, I think that's the way that we've approached this. I think the other couple things that I have felt are so very important in this time is one, just listening to people. We focus a lot on what goes on here in this hospital, but COVID has brought so many things to people's lives that are distinct and different. The economic impact for people lost their jobs, the family impact, people who have kids, right, having to do online school, something that I just, looking back, I don't know how I could have ever done that. So I have such great appreciation for people being able to not only do whatever they do during their normal day, plus, being the parents that they are, plus add on to it, being a surrogate teacher for their kids. It's really been challenging for people. And I think just listening to people has a great deal of impact. And you all have that same impact when you listen to people, whether it's a healthcare provider or anyone who's been impacted by COVID. I think that's really important. Our hospital epidemiologist has frequently said that COVID is humbling. And I think I've always felt like humility was an important characteristic that I have really strived to enhance in my life. But COVID has made each and every one of us more humble. Just realizing how little control we might have, but then taking the control that we're able to take. So, meeting the challenge that we can meet. And I think those are the things that have been helpful to me.
So how do you keep yourself motivated as we have seen new cases and worsening COVID developments recently?
I have a pretty positive outlook. Gina and I just had a conversation about this. I asked her the same question, actually. And, I think choosing to be positive is sometimes hard. And sometimes each of us may have that capability or not have that capability to choose to focus on the positive or focus on the good, versus being brought down by everything that's going on around us. I mean, this has been a horrible time in our country's history, in our nation's history, in our world's history. But still yet I've heard multiple times in the last week or so, people talking about what they have to be thankful for. And so I think I try to choose to be good, choose to look for the good. I also have been very blessed to have, people sending me notes and, just positive inspiration from people. I also think that watching people do their job is inspiring as well. And I think if each of us can find some inspiration in the things around us, I think that's very motivating. I also would say that within that support structure, I have a great husband, and he gets to hear a lot of my times when I'm not so up, and so he's very, very inspiring and motivating to me. And the last thing I will say is that I just try to remember why I'm here. The team is truly amazing. I mean, I haven't been to a lot of academic centers, but I can say that I am just so thankful and grateful for the people that work here and all of the hard work that they do. And when they can be positive, wow, why can't I?
So kind of following up with that, as a leader of a team, how do you keep your staff motivated in such tough times?
Yeah, I think very important that they know that you're being honest and open, because if you're not as a leader, then their ability to be motivated and to really put their best efforts forward is challenging. I think visibility is really important, and I have our marketing department has done a fantastic job of helping many of us to have more visibility. Recently, really stepped back and thought about the fact that I wasn't out in the units very much. I was, in meetings or, doing all sorts of things that were distracting from going out and seeing people. So going out and just being thankful to them and not only to recognize the good work that they're doing for our patients or for our institution, but also for the state of Iowa. Just reminding them that whatever they do each and every day not only helps the people in front of them, but it helps us to care for those in Iowa that need us. So I think being transparent, trying to communicate as best you can. I look back to that night when that first patient came in. There was a marketing person here writing the story so that when our staff woke up that morning, that they had in their inbox that we had admitted our first patient, as opposed to, hearing it on the news. And I think that is having that respect for our staff, that they should be the first, and therefore we're going to make it happen, was really important. And I would credit Suresh with that completely, 100%. He is a fantastic communicator and has actually taught me a lot in the last 8 months. And I really appreciate his transparency and his communication and over communication and communication again, to make sure that our staff know why we're here and that they feel appreciated during this really hard time.
So how has this pandemic altered your view on healthcare in the United States?
Yeah, it's a good question. Healthcare is disconnected. And I think one of the things that I have been able to see, and I think you all have seen, is how disconnected, even from, the role of public health and just this issue of, do we mask or do we not mask? And, COVID has brought so many unknowns, and I fully appreciate the fact that we have learned a ton during this pandemic. But just we're not universal. And there are probably times when we should be universal with having one voice. I think that the other disconnected part is that we each function kind of on our own. So, we are a hospital that takes a lot of patients in referrals. So patients are transferred to us for care. And those hospitals, send the patient, and then we communicate back with them after the patient's discharged. And that's kind of the extent of it. We don't function as a true network. We function more as individuals who interact and, to some extent compete, right? So, hospitals, healthcare is a business, and, competition for patients is real. I think that what I've seen in the pandemic is people coming together more as collaborators rather than as competitors, and really relying on each other. I will tell you that I think you're all aware of the fact that the emergency management system has divided the state into different regions. We are in Region 5, which is kind of the central and southwest part of the state. And I have had the pleasure of having communications with the CMOs of each of those hospitals now for many, many months. When the surge started to happen, just in the last month or so, we came together and have been having weekly meetings with the CEOs and the CMOs, really formulating plans of how we transfer patients, how we're each surging together or not, how we're all looking at elective surgeries or non-essential surgeries that require an inpatient bed because the beds have been so much in demand. And I think that the idea of healthcare being so disconnected, we've done a lot of work that has made us more connected, and I hope that in the future that continues. It's been good to get to know people and to hear what their struggles and challenges are, because we all have different struggles and challenges. We might have some that are constant and consistent, but there's a lot that is different about what we practice here versus what happens in Clinton, for example. I think that the other thing that I see is that we've seen a lot of silver linings in COVID. One of them was telemedicine. We were able to, all individuals in healthcare were able to stand up better telemedicine programs. And we went from just a handful of telemedicine visits now to, I don't remember the last number, but it's hundreds of thousands of telemedicine visits that we've had, both for patients who have COVID-19 or have symptoms of COVID-19, and also patients that don't. That's something that I think will do us well in the future. There's nothing like being a physician and sitting in front of a patient and having that interaction and being able to talk to the patient and examine the patient and get the studies that you need to be able to take care of that patient well. But not all of our patients need that. And there are clearly areas that we probably can even do better at caring for patients by not making them traverse across, hundreds of miles, for example, after they've had an operation, so that we can just take a look at their wound and make sure it's okay. So I think that the pandemic has helped us to make changes in medicine that we should have made before, but there wasn't a burning platform, and now there is.
Thank you for such an awesome answer to that tough question. So, kind of switching gears just a little bit, what is your favorite part about what you do?
Well, that's a tough question. I think it's having the opportunity to make a difference, and that difference is all about the people. My role as a CMO has really been focused on patients. I remember when I was considering the job, a colleague of mine asked me if I'd lost my mind. And I said, no, that I love making the patient in front of me better. But I just hope that this job would allow me to make patients that I never see or touch better by changing the systems and the operations and the protocols and things to have an impact on many patients. It's a big job, and it probably will never be done because there's always an opportunity for us to do things better. But I love, we had a great year for our quality improvement program, and I loved telling the story of how we decreased infections and improved patient outcomes, and how the team had come together working with the frontline team and the people who were taking care of the patients to change the way we practice in order to make some pretty significant improvements. Since COVID, I feel like my team has also had the opportunity to help to improve how our faculty and staff work each and every day, how we can keep them safe, and make sure that we have the appropriate personal protective equipment, that they know how to use it. And those, I love thinking about critical things. I love critical thinking. And I love a problem. I like helping to be a solver to a problem. And I think COVID has given us a lot of opportunity to do that. I was just in a meeting before I came here when one of our project managers made a comment about, nobody likes change. And I don't think that I necessarily love change, but I love seeing the outcome of change. And whenever you do change, you have to do it with people. And I think I'm a big people person. Love interacting with people, love hearing their thoughts. I would also say one of the challenging parts about my job is dealing with people, right? So people are important.
Absolutely. So as Mary Nell had mentioned at the beginning of this, there is no virtual volunteering option, but we've been amazed just at how well our volunteers and also our staff volunteer supervisors have stayed. They've continued to stay engaged with us, but we know that volunteers miss being here and our staff miss our volunteers. And our volunteers are just wondering, what can they do to help while they're not here?
That's a great question. Wear a mask. Wear a mask and avoid gatherings. You staying healthy helps everyone. It helps keep the people around you healthy. It helps keep our healthcare workers not overwhelmed. We've done a number of videos of our healthcare workers and what it's like to be in taking care of patients in one of our units that takes care of COVID positive patients. And it's a big balance between loving to do what they do and being exhausted by what they're doing every single day, but continuing to love what they do and continuing to work hard and do their very best every single day, even though they're tired. So that balance of making sure people know that we are always going to be here, And our people, even if they're tired, even if they're tired of this pandemic, they're going to continue to put their best foot forward each and every day. But you can help them by not getting infected, because the less people that get infected, the less people that require hospitalization. When in the beginning we talked about flattening the curve, and flattening the curve, I think some people thought flattening the curve was really about not letting people get infected, which it certainly was a part of that. But flattening the curve really was not exceeding our healthcare capacity. And so it starts with people not getting infected, but it also is about who's getting infected and how we're caring for them before they need a hospitalization, or avoiding them needing a hospitalization. And right now we're at a point where the healthcare system is significantly at risk. That's not just in Iowa. I saw a picture of the nation, and I think there are 2 states in yellow now. Every other state is in red. And so, if we were a red island in the middle of yellow, or if we were a yellow island in the middle of red, we could help each other out. But you may have, heard a story of a patient who was flown from southern Missouri, and they had called 28 hospitals. And this was a patient who had a life-threatening illness, and ultimately we took him. And so it's not just Iowa, but certainly in Iowa, we're feeling the pressure of not having enough resources to be able to care for people. So again, if you wear a mask, I know Thanksgiving is coming and we all want to be with our family, but you need to be really selective to keep yourself safe, to keep your family safe, and to not have us have another surge. I'm really pleased to say that we watch this data every single day. We look at the prevalence in the community, how many people per 100,000 are being diagnosed. We look at the positivity rates of the tests. We look at our own bed situation as well as the bed situation throughout the state. And I'm pleased to say that it looks like there's a nice start of a downturn trend in people getting diagnosed. The beds have even gone down a bit over the last couple of days, patients in beds. So we're starting to see some perhaps breather here, but we're all very worried about Thanksgiving and people traveling and interacting with people that they don't live with or who are not following the same safety practices that you are following. So that's how you can help. Wear your mask, avoid gatherings, keep yourself safe so that when we can get you back here, we can get you vaccinated and all will be good.
Absolutely. Well, Dr. Brennan, thank you so much for taking time out of your busy schedule. Those are all the questions that we had. So if you had any closing thoughts for our volunteers.
Just keep a positive attitude. We're going to get through this. I think if you watch the media, it can, we've not only had a tough pandemic, but we've had a whole lot of other things with the election, with the derecho. I will say, a funny thing, we do these emergency management drills on a routine basis, and we actually practiced a derecho a few years ago. So I actually knew what it was when it happened. But back to the positive outlook, rely on your family, rely on your friends, rely on your faith. Faith is very important to me, and that gets me through each and every day. Whatever it is that brings goodness to you, try to keep a positive outlook. When I see my patients in my clinic, I routinely go through what we call a review of systems, where I ask about headaches and weight loss and blood in certain places and things. I've begun over the last several months to always ask about mood and outlook, because our mental wellness for many has been so impacted by COVID. And so, do what you can to keep yourself up, get good sleep, do all those wellness things that you need to do. But if you need help, don't be afraid to get it. I've had some friends who have reached out, and and gotten help when they felt like they were just too down to be able to manage it. So use all the resources you can to keep both your physical health good and also to keep your mental health good, and until the time when we can get you back here. And I'm sure that it fills your bucket to come in and volunteer. And so without that, find something that fills your bucket. And if that's just me and Jean and Jilna and all the team telling you that we miss you and we want you to come back, hopefully that will help to fill your bucket as well.
Well, thank you so much, Dr. Brennan. I really appreciated your positive outlook on everything, and your insight was very helpful to us, the staff and the volunteers. And I'd like to just thank the staff and volunteers for joining us today to listen to Dr. Brennan. And so have a great afternoon and a happy Thanksgiving. And thank you, Dr. Brennan.
You bet. Thanks so much for coming, and happy Thanksgiving. Stay safe.
Take care, everybody.
Just hanging out.
I am about to end it. So
Okay, go for it.
unless, do you need help? I mean, you got all the participants, a couple people.
I got everybody. Bye.
Bye.